What's up, YouTube? It's your girl, Miss Sickle Sexy, coming at you with another video. This video is for Sickle Cell Awareness Month. As you know, September is Sickle Cell Awareness, and today, hold on, let's see. Today, yesterday, a lot of stuff went on, and it made me think of a vlog for today. And it is just basically the treatment of how sicklers get treated. And if you talk to other sicklers, you'll probably get the same story that you're getting from me. Okay. Um, Ever since I was like 10, when I moved down to Georgia, because that's where I live at, I started getting pain crises. And my very first hospital I went to was Children's Hospital of Atlanta, Hugh Spalding, and that is downtown Atlanta. And I'm gonna say right off the bat, I didn't like it. My experience from a 10-year-old all the way up to now has been very, very different. And honestly, I feel like it all depends on what hospital area you go to, okay, and how much knowledge and care they have. Now, at Hugh Spalding, even as a child, I got talked about. Eventually, when people got to know me, they treated me a little bit better. Some people treated me. Now, when you have any illness, you become moody. The medication may make you act funny. You may have moments where you don't remember. But to me, that's still no excuse to treat anyone bad. And I've tried my best to never treat anyone badly. Now, I remember my first incident. I was told that I kicked a pregnant lady in the stomach. And this was when I was like 10 or 11. I don't believe the lady was pregnant. I believe she was just a heavy set lady who didn't like me, who wanted to get over. I've had nurses and people that take my blood, that'll stick me and be rough with it, snatch needles out my arm, and blood will go everywhere. I've had an incident where I was told to like wake up, and I was trying to wake up, and the doctor herself hit me in the back, and I told my mother, and my mother went off. I've just had different experience. I've had experience where staff members will be like, up, here comes the drama queen. I've had experience where I've been called a faker, where I've been called a drug seeker, which a lot of sicklers get. And because I used to be a cutter in my teenage days, I really got looked at for being profiled for being a drug seeker. And you have to understand, you're 13, 14. I don't know what drugs is. All I know is I take this medication and it sucks and it makes me feel different and everything like that. I've had a lot of not so good moments with hospitals I've dealt with. I've been to Scottish Rite. That is a lovely hospital. They always made me feel comfortable. The most, and as I got older, of course, you have a moment where you transition um, to where you can't go to Children's Hospital no more because you're of a certain age. So I got transferred from Scottish Rite to Grady, and Grady sucks. Like, I understand that they help people who don't have insurance, but the nurses that's there, they really, really suck. The only time that I got treated good at Grady was when I had my son. And my whole pregnancy, basically, I was in the hospital most majority of the time. and I didn't have to share a room. But when I wasn't pregnant, I had to share a room. I would have experience where people would have their family members just be nosy, come over. I would report them. It doesn't matter. I had one instance where I was pregnant and I had to share a room with somebody, and I was in a pain crisis, and I had just found out I was pregnant. And of course, I started to show a little bit, and I had my pants kind of undid because my belly was getting in the way of my pants because my clothes were becoming too small. And this guy, the bathroom was on my side of the room. This guy, his wife was there, and he saw that my pants were unzipped, and he was looking at me, and I followed his eyes to where he was looking at, and he was looking at my vagina area and was like this, like, you know. I've had an instance where I've been admitted and in the Grady, and there was a dog in my room. And I understand everybody has different illnesses. I'm never judging anybody. But the fact that no one told me that I was going to have a nearly blind person in my room and that they were going to have a dog was startling to me. I've had people that shared a room with me that has been in my business have told their family members that they have someone in their room that has sickle cell. I've had an old lady try to fight me. Um, just all types of crazy stuff. And yesterday just made me remember that. And I'm the type of person, I try to stay to myself. I don't have any friends. I don't really know anybody. Um, and now I come to Emory, and I love Emory with all my heart. I love my doctor, Dr. Collins. Like, he has saved my life. He has made me feel like so, but now it's starting to become like Grady. Now, I'm not saying that some people call me attractive. I'm okay looking. All my life I've been called ugly, you know. But as I've gotten older and since I've been married, people have been attracted to me. And I don't know what it is, but people do some weird things to get my attention. And it makes me feel very uncomfortable because I'm married. Uh, Another thing is, my husband told me that it's okay for me to have male friends. And I'm like, okay, that's fine. So even though I don't like to talk to guys, I try to. So I had an incident yesterday where there was someone who worked at the hospital that I'm currently at. And I felt like the guy was kind of interested in me, not really sure, but he was nice. And recently this visit, basically I started to talk to him because I don't really talk to people. I say hello and I try to stay cordial. And basically every time he came in my room, I have this awesome game on my phone that I like to play, and we started talking over that. And I'm used to him delivering my tray and everything, and that's like, it was cool. So you got to get to know people. It's a lot of people that deliver my food here at the hospital, and I try to be cordial with them and nice, and some people I just click with. So I was like, "Hi, tell me your name again, because I'm so bad with names. I'm sorry." And he started asking me about my phone and everything like that. And so it became a point throughout the day where it started to get a little weird. Now, when I go into crises, I'm not really that hungry. I don't have an appetite. I'm nauseous a lot of the times. I don't really, eat. And so they sometimes call up to the hospital, which is probably what someone is doing right now, calling to see if I want dinner. Now, the guy, he kept coming around like every hour. I told him that I didn't want lunch. Yesterday, I was kind of groggy. I had a headache. The medicine that they're giving me is not really doing anything for me. So, I was a little bit in and out of it. So he comes by and he's like, do you want to order lunch? And I'm like, no. Now, here's the thing. They're supposed to knock on your door, okay? Or at least any courteous human would knock on your door, because you could be naked, you could be using the bathroom, anything. And I was like, who is it? Who is it? Who is it? And he just like busted in. I'm like, who is it? And I'm standing here and I'm not naked or anything. Like I said, I could be, but I was right here and I'm like, who is it? And he's like, oh. I'm sorry. I'm coming in here to basically talk about your food with you. And so he left out, and then I got back in my bed, and then he was like, he said, do you want me to just come back in 5 minutes? And I was like, no, come in. And I was like, aren't you supposed to not? And he was like, yeah, I'm supposed to do that, but and I'm like, oh, okay. So then an hour later, he comes back and he's like, hey, do you want me to pick up your food for you? And I'm like, no. Okay. And he leaves out. And an hour later, he comes back and he knocks, and my nurse is in here. And I don't say who is it, but I guess maybe he could have mistaken her voice for mine. So I let it go. I just was like, okay, I'm just not going to say anything. Maybe he didn't know. That's why he came in, because I prefer if someone knock, I say, who is it? You say who it is. And then you come in, and I say, it's okay for you to come in. So then I had my room door, like right now, I'm going to flip my screen around. This was how my room door was. So it's my bathroom door that you see open. And then it's on the other side is the entrance to my room door. And I had that open, and he came back again, and he like pushed the door, and once you push on it, you can kind of tell that something is blocking the way. And I'm like, who is it? Who is it? Who is it? And he's pushing and pushing in, and I'm like, who is it? And he's like, I'm just wondering if you want to order something. You just asked me an hour ago. I said, no, I told you I was not hungry. Why are you like just trying to barge your way in? And he was like, okay, I'm gonna come back. And I'm like, so that's when I confront my nurse and I say, hey, excuse me, can I ask you a question? I said, now, if a patient was to say, hey, can you not bother me for the few hours? I wanted her to respond, and she was like, I would be like, okay, but I have to come and check on you every 2 hours or so. She's like, but I would respect that. And I gave her the situation that the guy was very um adamant about coming back, and he could also call me, and my mom, she told me I should call security. And I was like, well, I don't want anyone to be like, well, you're lying on me, or I don't want anyone to be like, well, he works here, that's his job. It's just about how adamant you were, and you're coming in my room without even really letting me say, hey, come in. So my nurse was like, well, I can call the nurse. And me, I'm not a person who's about trouble. I just want to get my treatment, and I want to keep it moving and feel better and go home. That's it. And she was like, I can do that. And I was like, no. So 30 minutes later, he calls, and I guess he got my voice, and I guess he heard the tone in it and was like, okay, like she's kind of annoyed or whatever. And he was like, do you want something to eat? And I was like, no. And I didn't hear from him for the rest of the day. Now, second situation was I was in here sleep, and sometimes I sleep very, very hard, and I don't notice what's going on around me. You're on medication, you're really not getting any sleep, you have a lot going on when you don't feel good. And so I woke up to two different occasions where someone was in my room. Now, here's my thing: you hear weird stories. My husband called me a paranoid person, and fine, I'll take that. But I'll say I'm cautious. I see people are watching and commenting. I just want to say thank you guys. Like, wow, thank you. Two people. Like, shout out to y'all. I don't know what y'all are writing. I don't do this YouTube thing. This is new for me. But shout out to y'all that's watching. Like, leave a comment, and maybe I can holler at y'all and say something, like whatever you guys want to ask me. I can't see what you're saying right now, but I appreciate that. But I back to the story. I woke up to just some random person in my room. My husband calls me paranoid. I call me cautious. Whatever. And and I tell him, you hear different stories nowadays where people are disguising themselves, people are like security, and they raping people and everything. So imagine you're asleep, you don't know what's going on. So I wake up to some lady, she's just like staring at me, like standing in my room, and I'm totally freaked the fuck out because I just woke up. And you know how you have those moments where you wake up and you really don't know where you are or know what's going on. It was kind of like one of those moments for me. I was like, what the hell? And I was like, what are you doing? And she was like, I'm here to clean your room. Now mind you, yes, you may have on the outfit. Just because I wear scrubs, that does not mean I'm a motherfucking nurse, okay? Just because I wear scrubs, that doesn't mean anything. Like, I don't see your badge or anything. So I'm freaked out. I just woke up. I don't know you're here until now, until I sit up and see you. And she was just like staring at me like in a weird way, and it made me feel uncomfortable. And I was like, well, how long you're gonna be? Because I'm still kind of out of it and I'm freaked out. And she was like, I'm just getting your trash and I'm leaving. And I'm like, okay. And she gets my trash and she leaves out, and then she comes back and walk in my bathroom, and she leaves out and she slams my door. I'm like, okay. So I start to doze back off, and next thing I know, another lady comes in and she's saying something, but I'm not getting what she's saying because she's talking really fast. She's like, and I'm like, what? And she's like, something about some blood. And she was like, didn't I get your blood? And I was like, oh, okay, because I finally was able to make out what she was saying. And I was like, yeah, because I thought before I went to sleep, I thought my nurse did get my blood, because what they have to do is they check your blood. And I just got my blood exchange. If you go on my channel, you can see that I got my blood exchange like a couple of days ago. So what they do is they check my blood to see it did it go up, did it go down, is it stable or what. So I'm thinking, yeah, but that creeped me out too, because I'm just dozing back off and somebody just busts in your room without knocking. What are you gonna do? So then today rolls around. I'm to a point to where at the end of the day yesterday, I asked my nurse, I said, hey, can you just put a sign on my door that says, please knock before you come in, and like wait till you hear answer. And I went out there and I saw this on my door. So for someone to come in and, do that is wrong. So today rolls around, and I finally have enough strength to get up, and go want to go, and I want to take my shower and straighten out my room and everything. So my nurse tech, she comes in, and she's making my bed. And at that time I have on like the bottom part of my outfit and a bra, and I'm getting ready to go in the shower, and we're talking and everything, and next thing I know, somebody just, I hear my door open. I'm like, who is it, who is it, who is it? And the person is like, I'm here to clean your room. And I'm like, okay, and I'm stalling because I'm like, well, what do I do? Do I just tell the person to come in, or do I, just say, hold on, what do I do? Because I've had people literally get mad at me. So I told her, I was like, could you hold on? And I'm looking and I'm grabbing for a towel to wrap around me. And my nurse tech was like, oh, it's just the lady who cleans your room. And she gave me her name, and she was like, it's such and such. And she was like, it's okay, it's cool, you can let her in. And I'm like, okay. And I'm wrapping the towel around me, and I'm like, you could come in. And next thing I know, I don't hear anything. And I'm like, hello, you can come in. And the lady is just gone, like just gone. And my nurse tech, she was like, she kind of said something funny. She was like, I guess she walked away, she'll come back or whatever. And that's when I told my nurse tech, I'm like, I'm just tired of people catching an attitude with me, because I asked them like a normal human being, can you please knock on my door? Can you wait till I say come in or whatever? Because the thing is, what if it was you? Matter of fact, don't even think about what if it was you. What if it was your mother or your sister or someone in your family that was just being barged into? You have to understand that no one is here with me. I don't have my husband here with me. I don't have any family members here with me. So, and that's something, another thing that people do when you're a sickler, they'll try to take advantage of you if they notice no one is with you. And I had nurses and doctors do that to me all the time, like all the time. It was plenty of times when I was little, my mom wasn't able to be there because I have two other siblings. So people will take advantage of you. And for people to catch an attitude with you because you want to be treated like a human. I think that's kind of messed up, because just because I'm sick and most people don't say stuff when they're sick, that doesn't mean you should still treat them like crap. Like, that's really, really rude of you. So, my text, she comes back in and she's like, look, just let her come in here and clean your room. And honestly, I'm to a point to where I'm like, I'm fed up. Like, no, I'm just no. Um, and I don't want to deal with that attitude, because this is the thing. If you feel like I'm being rude, say, hey, I think you're being very rude. I try to be nice as possible as I can. I believe in treat people how you want to be treated. Really, I do. And the thing is that once you're rude to me and you like have an attitude, because to me, honestly, that was an attitude, you know. And I did hear her out there talking to my tech, like right before she came in, was like, hey, just let her, like, my tech shouldn't have to whisper to me, hey, just let her come in and do her work and don't say anything. Like, no, like, I'm a human being. Like, what do you mean? Like, I can't just let anyone, just because I'm sick, I'm not gonna let anyone just treat me like crap. And so now, because of like so much crazy stuff has happened, I already don't want to be here. I'm the type of sickler who, once I get what I need, let me go. Like, I already don't want to be in the hospital. I have plenty of things to take care of that I have to do. I have a child I have to take care of. I have a working husband. I have school that I have to attend that's coming up. I have no time to sit here and be plugged up to an IV pump getting medication that's really not doing anything for me. So, yeah, I told the doctors today, I was like, honestly, I just can't really take anymore. Just let me go home in the morning and I'll be fine. And honestly, like, I'll tell you guys this, because I want the people on my channel, I don't care if it's 10 people, I don't care if it's 2,000 people, I don't care if it's one person. I want y'all to know that, like, y'all are family to me. Like, y'all are my friends. Like, I want to get to know y'all. And honestly, and I guess this is where the paranoia kicks in, what my husband is talking about. When I was taking a shower today, I found a piece of hair on my soap. And I know that sounds weird. Like, you tripping over a piece of hair? But it wasn't my hair. That's the thing. And I know my husband's hair. Like, I know his pubic hair and everything. So it's like, I'm finna take my shower and I'm looking at my soap. And I just remember how many people had an attitude that cleaned my room. And so I called my husband and I'm like, hey, babe, like, when was the last time he was here? He was like, it was like 2 days ago, 3 days ago. I'm like, did you use my soap? And he's like, no. And I kind of figured he didn't, because I know his hair, like, for real. You've been with somebody for so long, you know it. So I'm like, this don't look like his hair. And it definitely don't look like my hair. So I was like, okay. And he was like, no, I didn't use your soap or anything. And I'm like, okay, honestly, I think someone like tried to sabotage my soap. And then I got another soap for my lady parts. And I'm up here like sniffing it, because like you can put stuff in it. And me, this is, I guess I am paranoid in a way. Call me paranoid if you want to, but hey, safety first. I'm like, does this smell like the stuff that they clean the rooms with? Because the stuff, if it was, it would have bothered me, because this stuff make me sick to my stomach nowadays. And I don't like the way it smells. And I'm just like pouring out tons of my soap in my hand, just like, it smells like it sort of. And then I was like, you know what? If I start burning or itching or something or turning red, I know they put something in my soap. And what I did for my body soap is, like, I got hot water and I was literally burning my hand, running the soap. Like, you know, I'm like, it's soap, so it should sanitize stuff, right? I'm like totally, no offense to anyone, a blonde, okay? Don't let the hair fool you. So I'm like, okay, it's soap. It should, any germ should come off, right? And I literally grab a towel and I scrubbed like some of the soap off, because it's one of those hand bars of soap. You know, you put it under water, it melts away. I'm like, okay, because I'm washing my body. Get that straight. Like, I don't do the dirtiness. Like I was telling my mother, I don't do the dirtiness. So yeah, maybe it is a little paranoia there, but I mean, you can never be too cautious. I done had some weird things happen to me as a sickler. And if you know anyone that has sickle cell, sit down and talk to them and hear their stories. They will probably tell you some strange things. Like, literally had people be like, when I come in the hospital, here come Miss Drama Queen. Like, how dare you speak to someone like that? Not only to someone like that, but a child. Because at the time, when people would say this, I was a teenager. I was like 15, 16. So it's like, how dare you talk to somebody like that? People just need to treat people how they want to be treated. Watch this show called What Would You Do? And it's a lot of scenarios on there that will make you think. And if you're one of those type of people who have a heart, and I'm not saying everybody don't have a heart. Some things I may say may sound cool, but like I said, if you do, let me know. But if you're like one of those softies, because deep down inside I'm a softie and I cry at a drop of a hat, you'll be like, hey, you wouldn't want to be in that situation. You wouldn't want none of your loved ones to be in that situation. Anyway, that's my story for today. That's my vlog. I'm not gonna say subscribe, do what you do what you feel. Um, but I want to say this, and this is something that I really want to get out there. This month is Sickle Cell Awareness Month. Every September, the whole month is Sickle Cell Awareness. Do me a favor, do your future generation a favor, do yourself a favor, do your loved ones a favor. Go get tested for sickle cell. If you are with someone you love and you are planning on having a family, make sure that you don't have sickle cell trait. Make sure that person don't have sickle cell trait, because if you guys get together, your child will have the full-blown disease, and that's not something you want, because it will flip your life upside down. You always hear people talking about cancer, diabetes, AIDS, but you never really hear people talk about sickle cell, or you never really hear people talk about, depression like that, or getting tested for certain stuff. You never hear people talk about autism, stuff like that. So please, go get tested for sickle cell. It's very, very painful. You have to go through a lot. Something I want to say also that will hopefully not try to scare people, but just so y'all can know, I'm 27. And so far, I've had heart surgery and hip surgery. Both of my shoulders need to be replaced, and my left hip needs to be replaced. I've already had right hip surgery, and I've had 4 ports. Okay. So, um, sickle cell is something very serious to me, just like autism is very serious to me. Those two illnesses are dear to my heart. So, like I said, I think next month is autism awareness. I think it's next month. It's normally around this time. I hope I didn't miss it. But yeah, you guys go get tested for sickle cell trait, and just know, because even some people with the trait, they get sick too, and you want to make sure that you're okay. So once again, it's your girl, Miss Sickle Sexy, coming at you with another video. Um, I love you guys. Thank you for making me feel special on like my third day by coming to watching my video. I really, really appreciate it. And I hope you guys have a good night. I hope you learned something or just heard me out. I really appreciate it. All right, y'all. I'll see y'all next time. Peace out.